Hi, this is Jill. Jill Speaks Wisdom. Please leave a like, a comment, subscribe. Today, I want to talk about a very important issue. Just so you all know, I've worked in healthcare. No, I'm not a nurse or a doctor, but I've worked with companies like in healthcare building business. So I would go to the hospital meetings. I kind of see statistically what's going on in the hospitals. There was a lot of information that the general public doesn't necessarily see. So what I want to say here is people are dying in hospitals every day due to medication errors. And I don't think a lot of people realize that. It's so important to know that medication errors are being made all the time in hospitals, and it contributes or is the reason for the death of the patient. I worked, as I said, I went into meetings and I saw some of the statistics on medication errors, and they're quite shocking. Had my own experience with my own father who was in the hospital, and he passed away there. And when I asked the doctor what kind of medications he was given, and I looked at the chart, I saw a medicine that I knew was contraindicated with his other medications, and it also had a black box warning. So I asked the surgeon, I said, did you know he was given that particular med? And he said, oh, no, I didn't. I guess the nurses had given it to him. I said, you didn't know? I said, did you know it had a black box warning? And he said, well, no, I'm not that familiar with that medication. This was from the surgeon. So these kinds of things happen all the time, and you can't trust the hospital staff. A lot of nurses are in it for the money, not all of them, and there's a lot of medication errors being made. Nurses being found to make up to 57% of medication errors. So there are some shocking statistics, and I just want you to pay attention at all time when you have a loved one in the hospital, that you know what they're being given, check the medicines out, make sure they're not contraindicated. Don't assume the staff knows better than you. Once again, medication errors are the leading cause of death in United States hospitals today. If you've had an experience with a loved one where something like this happened, please comment and share, because the more we all talk about this, maybe the more we can do something about it. Thank you so much, Jill.